Welcome to The Explainer. Today, we're going to tackle a subject that's a rite of passage and, let's be honest, a source of major dread for pretty much every medical student out there, pharmacology. But what if I told you it's not at all about just memorizing endless lists of drugs? There's so much more to it.
Okay, so let's just get right to the heart of it. If you're picturing pharmacology as, memorizing a giant phone book of drug names, well, you're about to discover a much, much deeper and way more fascinating story. So, what is the true purpose of pharmacology then? I'll tell you what it's not. It's not about becoming some walking encyclopedia of drug names. Nope. It's really about building that critical thinking foundation, the one that turns a student into a genuinely skilled physician.
At its core, you can pretty much boil pharmacology down to this powerful little three-part equation. See, it's not just about what drug to use, it's about how it works, how much you should give, and, this is the big one, how to use it safely. That right there, that's the fundamental philosophy of the entire field.
And this progression is absolutely key. You've got to start with the basic science, that's the mechanism. Then you build on that, connecting the dots to specific diseases. But the ultimate goal, that clinical level, it's all about knowing how to use that knowledge to actually heal someone without causing any harm.
All right, so how do we even build this foundation? Well, it all comes down to three core pillars. Seriously, you can think of these as the fundamental laws that govern every single drug you will ever encounter.
Every drug gets analyzed through these three lenses. First, you've got pharmacodynamics. That's what the drug does to the body. Then there's pharmacokinetics. You'll hear people call it ADME, for absorption, distribution, metabolism, and excretion. And that's what the body does to the drug. And finally, the clinical application. That's where all that science gets translated into actually helping a real live patient. Okay, now that we've got our framework, let's take a little peek at the actual course content. You're going to see it's organized in a really logical, system-by-system kind of way.
So the whole course is laid out around the different systems of the body. You start with the basics, those foundational principles, right? And then you work your way through everything, the nervous system, the cardiovascular system, and on and on. This structure is totally essential for taming what can feel like a super complex subject. All right, this brings us to what might be the most crucial part of this whole thing. How do you actually learn all of this stuff? Because, and let me be crystal clear here, just trying to brute force memorize everything, that is a recipe for disaster. It just won't work.
The secret? It's all about shifting your focus from what to how. Memorizing names is like trying to memorize the phone book. It's temporary, it's inefficient. But understanding the mechanisms, well, that's like learning the logic of the network itself. And that's where the true knowledge is.
So here's how you completely transform the learning process. Step 1, you start with the mechanism. Then, instead of trying to learn drugs one by one in isolation, you group them together by the diseases they treat and you compare them. Next, you organize all that info visually. Use tables, mind maps, whatever works. And finally, you bring it all to life by applying it to real-world patient cases. When you do that, what used to be this daunting memory challenge, it turns into a pretty engaging logic puzzle.
And here's the best part, the ultimate payoff of learning this way. Once you truly get the core mechanism of a whole drug class, like, say, beta blockers, you basically unlock the primary function of every single drug in that family. It's such a powerful and, honestly, an incredibly efficient way to learn.
Okay, now let's talk strategy for a minute. Because let's be real, based on actual med school curriculums and what students go through, not all topics are created equal. Not by a long shot. Knowing where to focus your energy is absolutely 100% critical for success. So think of this tiered system as your study roadmap. The stuff in that first priority rank, that's the absolute bedrock. You have to master it, no question. The second tier covers other really high-yield clinical areas. And then the third tier, it's still important, but it's generally a little less emphasized on exams.
And here's a huge pitfall to watch out for. Remember, pharmacology is a double-edged sword. Knowing what a drug does is literally only half the story. You have got to understand its side effects, how it might interact with other meds, and this is key, when you should not use it. All of that is just as critical, and you can bet it's gonna be on the exam.
All right, let's bring this all together. Let's really nail down the ultimate purpose of this whole challenging but super rewarding subject. At the end of the day, it's not just about passing a test. It's about preparing for a really profound responsibility.
This is what it all comes down to. This is that moment of transition, from just having academic knowledge to wielding a doctor's real-world power to heal and to protect. Every single fact, every single mechanism you learn, it all serves this one ultimate purpose. It's a really powerful thought, isn't it? The next time you see a prescription, just think about the incredibly complex web of decisions behind it. That simple piece of paper is the end result of a deep understanding of mechanisms, of safety, and of the unique needs of one individual patient. That is the true power and the real purpose of pharmacology.